All right, let's unpack this. Welcome to the deep dive. Today, we're embarking on a really vital exploration. We're looking at some of your body's most intricate systems, your kidneys, your eyes, your ears, even how you communicate verbally. Our
Mhm.
mission here really is to cut through the noise. We want to pull out the most important nuggets of knowledge from our sources just to help you understand what can go wrong, maybe why it goes wrong, and, most importantly, what you can actually do. How to protect these functions, what signs you absolutely need to watch out for. Think of it as your shortcut to safeguarding some pretty precious assets.
Yeah, and what's fascinating here, I think, is how interconnected these all are. They seem like separate things, right? Kidneys, eyes, but our sources show these common threads, things like chronic diseases, side effects from medications, even physical trauma. These don't just hit one spot. They can ripple across your health. We'll try and connect those dots for you today.
Okay, great. So let's start with those incredible workhorses, your kidneys. Real unsung heroes of filtration, constantly working. We'll look at sudden issues, inflammatory stuff, and those longer-term challenges they can face.
Right. First up is something called acute kidney injury, AKI. Now, this isn't slow damage, it's sudden, often reversible, which is the good news, but
Right.
it happens fast, like hours or days. Basically, your kidneys suddenly just struggle to filter waste, concentrate urine, keep fluids and electrolytes balanced, their main jobs.
Okay, sudden crisis. So what causes something like that?
Well, the causes kind of fall into three main buckets. The most common is prerenal. That means the problem is before the kidney. Usually it's about not enough blood getting to the kidneys. Think severe dehydration, maybe major blood loss, heart failure, even bad burns. And the key insight there, if you can restore that blood flow quickly, kidney function can often bounce right back.
Makes sense. Restore the supply. What's next?
Then there's intrarenal. This is direct damage to the kidney tissue itself. Common culprits. Certain drugs. We call them nephrotoxic kidney damaging. This includes some antibiotics like aminoglycosides or even common painkillers like NSAIDs, if used a lot.
Like ibuprofen?
Exactly. Or naproxen. Also, the contrast dye used in some scans can sometimes be an issue, and direct kidney inflammation, like acute glomerulonephritis.
Okay, so damage within the kidney. And the third,
That's postrenal. So this is an obstruction after the kidneys, something blocking the urine flow out. Could be kidney stones, maybe an enlarged prostate, or even tumors pressing on the ureters.
right, and AKI usually goes through phases. You mentioned that progression.
It typically does. There's an initiation phase, often kind of silent, you might not notice much, but the really critical one to recognize signs of is the oliguric phase. That's where urine output drops way down, less than 400 mils a day, often.
Okay, that sounds serious. Low urine output.
It is, because if that happens, you can get fluid overload, swelling, high blood pressure. And critically, high potassium levels, hyperkalemia, that's really dangerous for your heart. So low urine output isn't just, an inconvenience, it's a major red flag.
So watch for swelling, fatigue, shortness of breath then,
Definitely. If things improve, you might enter a diuretic phase. Urine output actually increases a lot.
which sounds good, but
But it can lead to dehydration and electrolyte loss if it's not managed carefully. Then, hopefully, the recovery phase where function returns to normal. But that can take time, weeks or months.
so the big takeaway for listeners dealing with potential AKI.
Early identification and treating the cause are absolutely key for reversibility. And two really practical points from the sources. One, daily weights. Checking your weight every day is the single best way to track your fluid status. Simple, but powerful. Two, recognize hyperkalemia signs. High potassium is a big deal. Muscle weakness, feeling generally unwell, irregular heartbeat. These need attention fast because it can lead to cardiac arrest.
And avoiding those kidney damaging drugs.
Absolutely, especially things like NSAIDs if you're at risk or already having kidney trouble. Super important.
Okay, so beyond that sudden injury, kidneys can also get inflamed, right? This nephritis category. How do we break that down?
Yeah, nephritis is kind of the umbrella term. Let's focus on two common types you might hear about. First, glomerulonephritis. That's inflammation of the glomeruli, the tiny filters inside the kidneys. Often it's triggered by the immune system, sometimes, say, a week or two after a strep infection, strep throat, or a skin infection.
And what would you see then? What are the signs?
We look for a classic trio. First, hematuria blood in the urine makes it look tea-colored or cola-colored. Also, proteinuria, that can make the urine look foamy. And edema, which is swelling, often starts around the eyes, then can become more general. High blood pressure is common, too, from the fluid retention.
Okay, cola-colored urine, foamy urine, swelling, got it. And pyelonephritis, how's that different?
Ah, quite different. Pyelonephritis is basically an infection, inflammation and infection of the renal pelvis and the kidney tissue itself. Think of it like an upper urinary tract infection, a UTI that's moved up.
So more like an infection presentation.
Exactly. Often more acute symptoms, fever, chills, feeling really unwell, maybe nausea, vomiting, and that classic flank pain, or what we call costovertebral angle tenderness, CVA tenderness. Pain in your back just below the ribs, often on one side.
And usually bacterial.
Usually bacterial, yeah. E. coli is the most common culprit, often travels up from the bladder.
So why is it so important for people to know the difference between these two, glomerulonephritis and pyelonephritis?
Well, because untreated pyelonephritis, that infection can get really serious. It can lead to urosepsis.
Sepsis originating from the urinary tract.
Exactly. A severe, life-threatening systemic infection. So the takeaway, recognize those upper UTI symptoms, fever, flank pain, and get treatment quickly. And again, you see that common thread. Avoiding those nephrotoxic drugs like NSAIDs and certain antibiotics is important for both conditions to prevent making things worse.
Right. Okay, so moving from these more acute issues, let's talk about the slower, more gradual decline.
Yeah.
The long-term stuff.
Yeah, we need to talk about nephrosclerosis. This is where the blood vessels in the kidneys thicken and harden. The main driver for this is usually long-term, uncontrolled high blood pressure, hypertension, but also things like atherosclerosis, hardening of the arteries in general, and diabetes play a big role.
And that hardening reduces blood flow.
Precisely. It chokes off the blood supply, leading to progressive kidney damage over time. It can be slow, kind of benign, or sometimes it accelerates rapidly malignant nephrosclerosis, which is a medical emergency.
So the key message there is blood pressure control.
Absolutely critical. Getting a handle on your blood pressure is the #1 goal to prevent or slow down this kind of silent damage.
And this type of gradual damage over years can eventually lead to chronic renal failure, or CRF.
Exactly. CRF is that gradual, irreversible loss of kidney function, months, usually years. And the most common causes, again, it's uncontrolled diabetes and hypertension. They're major players in long-term kidney damage.
And CRF is staged
Mhm.
based on how well the kidneys are filtering.
Right. Based on the glomerular filtration rate, the GFR, stage 5 is basically kidney failure, where you'd need dialysis or a transplant to survive. And, if we connect this to the bigger picture, CRF isn't just a kidney problem. It hits almost every system in your body. It's systemic because waste products build up. That's uremia fluids get out of balance, electrolytes go haywire.
Wow. So what kind of symptoms are we talking about?
It's a huge list. Neurologically, maybe feeling tired, confused, restless legs, cardiovascular high blood pressure, heart failure, even inflammation around the heart, pericarditis, GI symptoms like nausea, a metallic taste, maybe that uremic fetor, which is sort of a urine-like smell on the breath, musculoskeletal bone pain, higher risk of fractures. Hematologic anemia is very common, and you might bleed or bruise more easily.
That really underscores how vital kidney function is. So for managing CRF, what are the absolute must-knows for someone going through this?
Management is complex, no doubt, but the core ideas are strict fluid and electrolyte balance and a really specific diet. Often it's low protein before dialysis to ease the load on the kidneys. But then on dialysis, protein needs usually go up. Low sodium, low potassium, low phosphorus are usually key dietary rules too.
And those daily weights again.
Still crucial. Daily weights remain the most accurate check on fluid status. And knowing those signs of hyperkalemia, the muscle weakness, the irregular heartbeat, still vital for safety. The main thing is understanding that managing CRF means managing your whole body, not just your kidneys. It requires a team effort.
Right. A very holistic view needed. Okay, let's shift gears now. Let's talk about our senses and communication. Starting with our eyes, our windows to the world. Incredibly intricate and pretty delicate too. When it comes to eye injuries, what needs immediate action? Say someone gets something in their eye or a chemical splash. What's the absolute first step?
Okay, super important. If it's a penetrating wound or something is stuck in the eye, an embedded object, the absolute key is, do you try to remove it?
Don't pull it out.
No, stabilize it. Maybe tape a paper cup over the eye, something to protect it from bumps and prevent movement, then get emergency medical help immediately. For chemical burns, time is critical. The first, most vital step is immediate and prolonged irrigation, flushing the eye.
With what?
Normal saline if you have it, but even just plain tap water is fine. Flush for at least 15 to 30 minutes. Tilt the head so the affected eye is down, letting the water run away from the other eye. Do this before you even head to the ER. Every second counts to minimize damage. And yeah, protective eyewear for prevention sounds basic, but it works.
Good advice.
Mm.
Okay, Moving from sudden trauma to more gradual changes. Cataracts. We hear about those a lot, especially with aging.
Right. Cataracts are a clouding of the eye's natural lens. Think of it like looking through a foggy window. Often due to aging, but also trauma or diabetes can cause them. Leads to blurry vision, problems with glare, especially at night. Makes driving tough.
And surgery is common.
Very common and usually very effective. It's typically outpatient surgery, but the key insight for after surgery is avoiding anything that increases pressure inside the eye. So no bending over at the waist, no heavy lifting, no straining like during a bowel movement. You need to protect that healing eye from pressure spikes.
Okay. Now, glaucoma. Often mentioned alongside cataracts, but you said earlier they're quite different.
Absolutely. What's fascinating and kind of scary about glaucoma is how sneaky it can be. While cataracts cloud your vision, glaucoma is often called the silent thief of sight. Why? Because it's a group of diseases where increased pressure inside the eye. Intraocular pressure, or IOP, damages the optic nerve, and it causes progressive, irreversible peripheral vision loss first. Your side vision goes, often without you noticing until it's quite advanced.
So you might still see straight ahead okay for a while.
Exactly, which is why it's so dangerous. The key insight. Regular eye exams are crucial, especially as you get older, even if your vision seems fine. Early detection and sticking religiously to prescribed eye drops to lower that pressure are the only real ways to manage it. Lifelong commitment, usually.
And certain other medications can be a problem.
Yes, definitely. Particularly for a type angle closure glaucoma, certain drugs like atropine and others called mydriatics, basically, drugs that dilate your pupils must be avoided. They can trigger a sudden, dangerous rise in eye pressure. Always tell doctors you have glaucoma.
Okay, so glaucoma affects peripheral vision first. How does that differ from macular degeneration?
Good contrast. Macular degeneration affects the macula. That's the central part of your retina, responsible for sharp, detailed, straight-ahead vision. So unlike glaucoma's side vision loss, macular degeneration causes loss of central vision, makes it hard to read, recognize faces, see details. But your peripheral vision might still be okay.
Opposite pattern, almost. What are the risk factors?
Age is the biggest one, but smoking is a major modifiable risk factor, and long-term UV light exposure. A really neat tool for early detection that you can use at home is the Amsler grid. It's basically a grid pattern.
How does that work?
You look at it daily, one eye at a time. If the lines appear wavy, distorted, or if there are blank spots, that's a sign to report immediately. It can catch changes early. And, of course, quitting smoking and using good UV-blocking sunglasses are really important protective steps.
Right. And finally, for eyes, what about a detached retina? That sounds like a true emergency. What are the signs?
It absolutely is an emergency. A detached retina is typically a sudden, painless loss of vision in one eye. Often comes with warning signs like flashes of light, we call that photopsia, or a sudden increase in floaters, those black spots or cobweb-like things drifting in your vision. And sometimes people describe a curtain or shadow or veil coming down over part of their vision.
Any of those signs mean immediate action?
Yes. Urgent. Get to an ophthalmologist or ER right away to prevent permanent blindness. The priorities are minimizing eye movement. Sometimes strict bed rest, specific head positioning might be needed. And after surgery, especially if they use a gas bubble to hold the retina in place, following positioning instructions is critical. Also, a really important point. If you have a gas bubble put in, avoid high altitudes or flying until your doctor clears you. The bubble can expand with pressure changes and cause serious problems.
Wow, okay. Good to know. So, beyond sight, let's quickly touch on hearing and speaking.
Right. Hearing impairment can be broadly split into two types. Conductive hearing loss is a problem in the outer or middle ear. Sound waves are physically blocked, could be simple earwax buildup, cerumen impaction, or maybe a middle ear infection, otitis media, often treatable. Then there's sensorineural hearing loss. That's damage to the inner ear, the auditory nerve, or the brain pathways.
And causes for that.
Common ones are age-related hearing loss presbycusis, also damage from chronic loud noise exposure, and importantly, certain ototoxic drugs.
Okay, you mentioned those kidney-damaging drugs earlier. Some drugs can also damage hearing.
Yes, that's a key point that sometimes gets missed. Certain drugs are known to be ototoxic. Specific antibiotics like aminoglycosides, gentamicin is one, powerful loop diuretics like furosemide, even some chemotherapy agents. If you're prescribed any of these, it's really important that your hearing is monitored and you report any changes like ringing in the ears or hearing loss right away.
And for that common age-related hearing loss, presbycusis. Any tips?
Yeah, simple things help. Speak clearly, but in slightly lower tones, high frequencies are often lost first. Face the person directly so they can see your lips. Reduce background noise if you can. Makes a big difference.
Good practical advice. Lastly, verbal impairment. Difficulty speaking. What causes that?
Can stem from various things, often neurological. A stroke is a big one, leading to aphasia. That can be expressive difficulty getting words out, even if you know what you want to say, or receptive difficulty understanding what's being said, or global affecting both. Other causes include muscle weakness affecting the speech muscles, that's dysarthria, or problems with the brain coordinating the movements for speech, called apraxia of speech.
So if you're communicating with someone facing these challenges,
Patience is absolutely number one. Speak slowly and clearly. Use short, simple sentences. Yes, no questions can be easier to answer. And definitely use nonverbal aids. Gestures, pointing, picture boards, writing, communication apps on a tablet, whatever helps bridge the gap. The key insight is really to avoid causing more frustration. Like, for someone with expressive aphasia after a stroke, giving them a communication board and plenty of time is crucial. Telling them to try harder just increases distress. Connection is the goal.
absolutely, patience and finding the right tools. Okay, we have covered a lot of ground in this deep dive. Kidneys, eyes, ears, communication, really fundamental aspects of our health.
Yeah, and if we circle back and connect it all, the bigger picture really shows those shared risks and strategies, doesn't it? The huge importance of managing chronic conditions like high blood pressure and diabetes, being really aware of medication side effects. Are they nephrotoxic, autotoxic, protecting ourselves from injury eyewear, avoiding excessive noise, and just the critical need for early intervention when things change suddenly or persistently?
So wrapping up, what does this all mean for you listening right now? It means recognizing those early signs can be game-changing. A big change in urine output, those sudden flashes or floaters or a curtain in your vision, new problems hearing or speaking clearly. Catching these things early can truly make a massive difference in the outcome. It can protect your quality of life down the road.
It really can.
So maybe take a moment to consider your own daily habits, your diet, exercise, medications, even how you handle stress. How might these be quietly impacting the long-term health of these absolutely vital systems? What's maybe one small intentional change you could make, starting today, to better protect these functions that let you experience and interact with your world? Something to think about.